Good afternoon. My name is Grace Jones with Dayton Children's Hospital, and today we're here to talk about sleep apnea and breathing problems during sleep for children. And I have two wonderful experts with me here today, Dr. Kalra and Dr. Elluru. I'm going to have them introduce themselves, and then we'll get right into the questions. So Dr. Kalra, can you introduce yourself and tell us a little bit about your specialty and how you treat children with breathing problems during sleep?
Thank you, Grace. Good afternoon. My name is Manindra Kalra. I'm the Chief Division of Sleep Medicine and the Medical Director for the Sleep Lab at Dayton Children's Hospital. I help in evaluating children with a variety of sleep disorders and then participate in diagnostic testing and working with my colleagues in different specialties, especially otolaryngology, to help manage children with these problems.
Great. And Dr. Elluru?
Thank you, Grace. My name is Elluru. I'm one of the pediatric ears, nose, and throat doctors here at Dayton Children's Hospital. I am the division director as well of our pediatric ENT group. Been here for about 7 years. The difference between ENT and pediatric ENT is that I've done some additional fellowship training in specifically kids in pediatric ENT. Dr. Kalra has been a great friend of mine, one of the nicest people I've known, and a great collaborator for over 25 years. So I enjoy working with him on, these cute little kids with sleep-related breathing disorder. As Dr. Kalra mentioned, a lot of what we do together is the diagnostic and treatment arms. I'm often more involved in the treatment arms, especially if there is a surgical treatment option available.
Okay, great. Well, let's dive into the questions. I know a lot of parents might want to know, how common are problems with breathing during sleep in children, and when should a parent be concerned?
So breathing problems during children are quite common. Among these problems, snoring, which is the most common problem, where the child makes the noise of snoring without stopping breathing or having drops in their oxygen or poor sleep quality, may affect up to 10% of children. And the less common problem, obstructive sleep apnea, affects 1 to 4% of children. And these children, there is either a partial or complete blockage of the airflow into the lungs, resulting in poor sleep quality and abnormal oxygen or carbon dioxide levels during sleep.
So when might a parent notice that something is wrong and need to get something checked out?
So parents should be concerned when the snoring is frequent, and as experts, we classify that happening 3 or more nights in a week when it's loud and is associated with restless sleep, daytime sleepiness, or daytime behavior problems, including learning problems.
Okay. So go ahead, Dr. Elluru.
One of the things, if you wouldn't mind mentioning, Dr. Kalra, is there effects of sleep deprivation on focus and hyperactivity?
Right. So definitely one of the driving forces for interest in sleep medicine is the knowledge that poor sleep due to breathing problems has been shown to affect learning, academic achievement, as well as leading to behavior issues such as hyperactivity. And there's a lot of overlap between attention problems in children and poor sleep.
And one of the things I tell parents a lot, Grace, is, all of us have gone through periods of time where we're, as adults, chronically sleep deprived. And we know how we behave the next day. It's hard to focus on tasks. It's hard to not be fidgety, impulsive. In fact, sometimes, when I don't sleep well, I notice the next day that I'm impulsively snacking and things like that.
Mm-hmm. Yeah. So what causes this in kids? What causes them to have problems with breathing when they sleep?
I can take that if you would.
Yeah.
So typically there is a restriction to airflow. So there's an increased resistance to airflow anywhere from the tip of the nose down into the trachea and lungs. That can cause not only snoring, but that spectrum of disease all the way into obstructive sleep apnea. So it has to do with the patency of the nasal passages, the back of the nose, the back of the throat, and even sometimes the patency of the trachea. Fortunately, the most common problem is large tonsils and large adenoids obstructing the airway and decreasing the patency. And so that's fortunate because there is a good treatment option for them, and that is to take out the tonsils and the adenoids.
Okay. And then how, and Dr. Kalra or Dr. Elluru, either one of you can answer this, or both maybe, how do you diagnose these problems with breathing during sleep?
So, Grace, first of all, as a healthcare provider, we do a detailed history and physical exam to look for the symptoms and signs of obstructive sleep apnea. And the symptoms, pretty much, as we talked about earlier, are the presence of snoring, how frequent it is, how loud it is it associated with stopping in breathing, restless sleep, abnormal sleeping positions, increased work of breathing, or excessive sweating. Often bedwetting can be a symptom too. And then teasing out if the child is getting refreshing sleep by asking if they are difficult to wake up, as well as sleepy during the day. And physical exams, like Dr. Elluru mentioned, focus on the size of the airway and whether any soft tissues are blocking the air passage. The overnight sleepover test, called the sleep study, is the gold standard to make the diagnosis. And during the sleep study, the child is breathing, oxygen levels, heartbeat, and electrical activity of the brain are recorded. And this information allows assessment of whether sleep apnea is present and whether it is affecting the quality of the child's sleep. And this information then is utilized by specialists who are like Dr. Elluru, who are planning treatment strategies, including surgical options.
Okay, great. And so then what are the different additional treatment options?
So the most common one, Grace, is a adenotonsillectomy. So take out the adenoids, which are the tonsillar tissue in the back of the nose, and then the tonsils are straight back in your mouth. So you take those out, and typically that leads, in most kids, to a good outcome, resolution, if not near complete resolution of their symptoms.
What age do you normally start seeing kids with this or treating it, or does it really run the gamut?
It does run the gamut, but we do know that the peak age of adenotonsillar enlargement is between 2 to 6 years of age.
Okay.
And we are also seeing an epidemic of childhood obesity. So patients who are in their early teen years, especially with comorbid obesity, we are seeing an increased prevalence of sleep apnea.
Okay. And then are there certain populations of kids who are more likely to have problems with breathing during sleep?
Yeah, Grace. So, we talked about how, sleep apnea, breathing disorders during sleep are because of increased resistance anywhere from the tip of the nose down to the trachea. And there are some kids who are born with not only, bigger tonsils and adenoids, but also have narrow nasal passages. Their back of the nose is narrow. They can even have some narrow back of the mouth and collapsibility of the mouth and collapsibility of the trachea. So any one of these levels of obstruction, as well as multiple levels put together, can cause some kids to be more predisposed to sleep apnea than others. So kids who have craniofacial dysmorphisms, especially kids with Down syndrome, can have a lot of the features of narrow nasal passages, narrow oral pharynx, collapsibility issues, things like that, that make them more predisposed than other kids to sleep apnea.
Okay.
And we do see that there is a familial aggregation. So if you have a parent with sleep apnea, you're more likely to, the child is more likely to have sleep apnea. And some of it we think is due to their airway size, like Dr. Elluru said, how our facial structure is. But some also is due to the control of breathing, which is under genetic control. So that's the group that when we're looking for alternate treatment options, we could look more for non-surgical options, pursuing weight loss, pursuing other procedures such as a dental specialist would provide, which would look at correcting that problem.
Okay.
And so the trick, Grace, truly is to figure out, so as we mentioned, there are certain kids who are more predisposed to sleep apnea, and not only more predisposed, but are actually a little more complex in diagnosis of not only the sleep apnea, but what level of obstruction they have causing the sleep apnea. And that's where Dr. Kalra and I really collaborate heavily to manage these kids, because it's often not simple enough to take out just their tonsils and adenoids. It does help to a small degree, but as in other kids where taking out the tonsils and adenoids will almost completely resolve their sleep apnea, in these higher risk kids and more complex kids, it'll help a bit, but not completely. And so we have to start looking at the anatomy together very carefully to figure out if there's other surgical treatment options besides taking out the tonsils and adenoids, and or some of the treatment options that Dr. Kalra mentioned.
Yeah, I think that's great. And that's what I was going to ask too, is how do you guys both work together? I think a lot of parents often think, oh, I just need to see sleep medicine, or I just need to see ENT, but you guys really work collaboratively, especially on more complicated cases, correct? Dr. Kalra, do you have anything else to add on how you two work together on these cases?
Right. So I'll echo what Dr. Elluru mentioned, that to develop a personalized approach in these complex cases, we will review the diagnostic results together, the anatomy findings that Dr. Elluru has and his colleagues have obtained, plan some specialized testing such as MRI or sleep endoscopy that our ENT colleagues will have expertise in. And then sometimes we will bridge to surgery a non-surgical option called continuous positive airway pressure, the CPAP machine that is very popularly used in adults with sleep apnea. And sometimes, when we are evaluating these patients for follow-up and there is some residual sleep apnea still persisting despite surgical treatment, we can then look for additional treatment options such as oxygen alone or the CPAP machine. And definitely, in trying to plan surgical treatments, there's a lot of collaborative effort that goes in, including surgeries which are not conventional, such as looking at removing a special kind of tonsils called lingual tonsils, which is not that common.
Okay. So if a parent is watching this, they heard you talk about the snoring or, other behavioral things, seeing the kids seeming like maybe they're not getting enough sleep, these different symptoms, and maybe they're concerned. What should they do? Should they talk to their pediatrician? Should they do something else? What would you guys suggest that parents do if they're watching this and think that their child may have this?
Talk to their pediatrician. That's the best thing to do. Start with their pediatrician and let their pediatrician figure out, kind of the appropriate referrals after that.
Okay.
Yeah, I agree fully that bringing it to the attention of their healthcare provider, and then they'll triage or select what is best suited for that individual patient, and then each specialty can contribute to providing the care for the child.
Okay, great.
And Grace, probably the one thing I'd love for parents to know is that we don't work in isolation. Whether the patient comes to see Dr. Kalra first or me first, doesn't matter. Dr. Kalra, once again, has been a friend and a great colleague for over 25 years. We've done not only managed a lot of patients together, we've done a lot of research on this subject together. We published papers together. We are going to work together on every single patient needed to provide the best outcome. And this is a really nice collaboration because both of us bring in completely different perspectives to the issue. And so what I may not see, Dr. Kalra does see clearly, and vice versa. And we can come up with some good treatment options.
Great. Well, is there anything else that I didn't think to ask you, either one of you, that you wanted to make sure to leave our parents with today?
One thing I would like to point out that sometimes parents have this misconception that this overnight sleepover test, their child cannot handle it. It is performed by specially trained technicians who are certified, and they work with kids at Dayton Children's. And we perform over 1,500 of these procedures. And I can tell you a good 98% of the children tolerate it very well. So it's a tool which will help determine their problem that the child is having or not having in their sleep. So I just wanted to clarify that for parents.
Yeah, that's really helpful. Great. Well, thank you both so much for joining us today. I think this is really helpful. And for those who watch, I hope that you found it helpful as well. And I hope you guys all have a great day. Thank you so much.
Thanks, Grace.
Thank you, Dr. Elluru.
Thank you, Dr. Kalra.